What if your urine could reveal the first signs of a serious health problem before you ever feel sick? Most people think changes in color, smell, or frequency are nothing to worry about, just part of getting older. But after 60, these small changes can be your body's only warning that something dangerous is happening, long before pain ever starts. Every day, your kidneys filter 50 gallons of blood, quietly removing toxins and balancing your body's chemistry. But when something goes wrong, diabetes creeping in, an infection spreading, or kidney disease silently progressing, your urine often tells the story first. The problem? Too many seniors never get the message. Today, we're revealing 5 silent warnings hiding in your urine, signs you must not ignore. These are clues you can spot without any expensive test. Clues that could save your kidneys, your heart, even your life. And stick with me until the end, because warning number 5 is the one doctors say almost no one notices in time. Asterisk. Many seniors think changes in urine are just part of aging, but that's a dangerous mistake. What seems like just getting older can actually be your body's first cry for help. After 60, your kidneys, bladder, and urinary tract don't bounce back the way they used to. Years of medication, dehydration, or hidden health issues quietly take their toll. A little extra foam, a slightly stronger odor, a bit more urgency at night. These are the whispers your body uses before it starts shouting in pain. Ignore them, and you could face late-stage kidney disease, uncontrolled diabetes, dangerous infections, or even hospitalization. And by the time pain or fatigue finally appears, the damage is often harder and more expensive to reverse. But here's the good news. Catching these signs early is simple. It doesn't require invasive tests or endless doctor visits. In many cases, a single urinalysis or simply knowing what to look for can give you months, even years, of warning. This is why these clues matter so much after 60. They give you a chance to take control, protect your organs, and stay independent longer. So how do you know if your urine is trying to warn you? That's exactly what we're about to reveal. 5 silent changes you must not ignore. Up next, the 5 silent changes that tell you something is wrong, long before you feel sick. Warning number 1 coming up. Warning sign number 1. Persistent dark, cloudy, or foamy urine. Most people blame dehydration, and yes, that's sometimes true. But if your urine looks darker than usual even after drinking plenty of water, or if it looks bubbly or foamy every time you flush, that could mean protein is leaking into your urine. Why does that matter? Healthy kidneys are like ultra-fine filters. They keep your blood clean, but hold on to valuable proteins your body needs. When those filters are damaged by high blood pressure, diabetes, or age-related wear and tear, they start to leak. And the very first place you see it? In your urine. What makes this so dangerous is how quiet it is. You won't feel pain. You won't feel sick. By the time fatigue, swelling, or shortness of breath show up, kidney damage is often much further along. But here's the good news. This is one of the easiest problems to catch early. A simple urine protein test at your doctor's office can confirm what's happening, and lifestyle changes or medications can slow or even stop the damage before it becomes serious. So if you notice your urine staying dark or bubbly for more than a couple of days, don't just assume it's nothing. Stay hydrated, but also ask your doctor about a quick urinalysis. It's painless, inexpensive, and it could save your kidneys from years of silent damage. But foamy urine isn't the only danger hiding in plain sight. Wait until you hear about the smell that could signal diabetes. Warning number 2 coming up next. Warning sign number 2. A sweet or fruity smell in your urine. Most people never notice, or they shrug it off as nothing. But this subtle change can be an early sign of high blood sugar. When your body can't properly use glucose for energy, that excess sugar has to go somewhere. And one of the first places it shows up is in your urine. Think of it like this. Healthy kidneys filter your blood but normally hold on to sugar because your body needs it as fuel. When blood sugar levels climb too high, your kidneys start pushing that sugar out into your urine to protect your bloodstream. The result? A sugary or fruity odor that can be surprisingly strong. Why is this dangerous? Because it often appears months, even years, before other symptoms of diabetes show up. You might not have vision changes. You might not feel tired yet. You might not even know your blood sugar is creeping up, but your urine is already sounding the alarm. Ignoring this sign can lead to nerve damage, kidney disease, or heart problems down the road. But catching it early can help you control your blood sugar with simple changes, often without major medication at first. If you ever notice a sweet smell, especially if you also feel unusually thirsty, make an appointment with your doctor and ask for an HbA1c test. It's a simple blood test that shows your average blood sugar over the past 3 months, a clear picture of whether diabetes is sneaking up on you. The sooner you know, the easier it is to prevent complications, protect your energy, and stay healthy well into your golden years. Asterisk. Early clue, long-term protection. Early test equals early control. But what if your urine shows blood, even when you feel fine? That's warning sign number 3. Warning number 3 coming up next. Seeing even a faint pinkish hue in your urine can feel alarming, and it should. Blood in the urine, even if it's just a trace, is never normal. For seniors, it could point to a urinary tract infection, bladder or kidney stones, or, in some cases, early signs of cancer. What makes this symptom so dangerous is how easy it is to dismiss. Many seniors blame it on medications, dehydration, or simply getting older. But ignoring this warning sign is like silencing a fire alarm. The danger doesn't go away just because you pretend it's not there. This isn't about scaring you, it's about empowering you. You've worked too hard for your health to let something small sneak up on you. Your body is sending you a message. Pay attention. Protect yourself. Call your doctor immediately. Ask for a microscopic urine test or a cystoscopy if blood is confirmed. Don't wait for the discoloration to appear again. By then, the condition could already be worse. Early testing can mean the difference between a simple treatment and a serious diagnosis. Have you or someone you know ever ignored a warning sign, only to regret it later? Share your story in the comments. It might save someone else's life. As we age, our immune system weakens and the bladder lining becomes more fragile. This makes infections, stones, and even small tumors easier to develop and harder to detect early. What you catch in time can be treated. What you miss could change your life. Blood in urine is not equal to normal aging. Could be UTI, stones, or cancer. Test early. Microscopic test is key. Don't wait. Call to keep watching. And that's just one of the 5 hidden urine clues. The next warning sign is something you can smell, and it's linked to silent diabetes. You don't want to miss this. Many seniors chalk up frequent bathroom trips or nighttime urgency to just getting older. But when you're waking up every hour or feeling that sharp burning pain, your body may be warning you about more than an inconvenience. These aren't just annoying, they're red flags. Every time bacteria sneak into your urinary tract, they can climb up to the bladder, and if ignored, they may reach the kidneys. That's when a simple infection turns dangerous, leading to fever, weakness, even hospitalization. And here's the catch: infections in older adults can move fast and sometimes trigger confusion or dizziness before you even notice the pain. Frequent urination, especially at night, also strains your sleep, raises blood pressure risk, and may hint at underlying bladder changes. Whether it's a urinary tract infection, bladder inflammation, or even an early prostate issue in men, you shouldn't dismiss these symptoms. Visualize your bladder like a shield. When it's healthy, it flushes out bacteria naturally. But when something's off, dehydration, reduced immune strength, or poor emptying, germs multiply. That burning sensation or constant urge is your body pleading for help, not permission to wait and see. What can you do? Early testing is simple and life-saving. A urine culture can identify bacteria long before they spread, allowing your doctor to prescribe targeted antibiotics. And if it's not an infection, testing can reveal other causes, like overactive bladder or prostate enlargement, conditions that can be managed before they spiral into emergencies. The fix often starts with hydration. Clean water keeps your system flushing. But don't stop there. Document when symptoms happen, how often, and what you feel. Bring that record to your next appointment. And if you ever see fever, chills, back pain, or sudden confusion alongside these symptoms, that's not a wait-and-see moment. That's an emergency. Bottom line, waking up to urinate once at night may be normal, but waking up 3, 4, or 5 times, or feeling sharp pain, isn't. You deserve restful nights, clear days, and healthy kidneys. Don't let a preventable infection steal that from you. Bacteria traveling up the urinary tract, glowing as they spread. shield weakening, showing bacteria passing through. Early urine cultures equals early treatment equals no kidney damage. Early urine cultures stop infections before they damage the bladder or kidneys. If you feel burning or keep running to the restroom, don't wait. Get tested. Unusual odor or cloudiness, infection or dehydration. Does your urine sometimes smell stronger than usual or look cloudy, almost like diluted milk? This isn't just about diet. A persistent foul smell or haziness can mean your body is fighting bacteria or struggling to flush out concentrated waste. Seniors are more vulnerable to silent urinary tract infections because symptoms can be subtle or mistaken for aging. Don't brush it off as just not drinking enough water. Start by increasing fluids. And if the odor or cloudiness sticks around for more than a day or two, ask your doctor for a simple urinalysis. It's quick, painless, and can rule out infection before it spreads. Your kidneys work around the clock to filter out toxins, keeping every other organ running smoothly. A little extra attention now can prevent serious trouble later. These warning signs are easy to miss, but your body whispers before it shouts. And we've saved the most surprising insight for last. A quick recap that could change how you think about kidney and bladder health forever. Don't miss it. Your urine is like a health report card. You never have to study for if you know how to read it. These 5 signs aren't random. They're your body waving a yellow flag. And the earlier you notice them, the sooner your doctor can investigate and take action, often stopping small problems before they turn serious. Here's your rapid recap. 1. Dark or tea-colored. Think dehydration or liver stress. 2. Sweet or fruity smell. Could be a diabetes clue. 3. Pink or blood-tinged. Never ignore it. Infection or stones may be brewing. 4. Frequent or painful trips. UTIs need early testing. 5. Cloudy or foul-smelling. Time to check for infection or concentrated waste. The takeaway? Early detection makes treatment easier and your quality of life longer. Which of these silent urine warnings surprised you the most? Was it the foam, the pinkish tint, or maybe the sudden odor change? These aren't just random signs. They're your body whispering that something's wrong before it shouts. And here's the amazing part. Many seniors have caught kidney problems, infections, or even early disease, simply because they noticed these tiny clues and got tested in time. Have you ever caught a health problem early because of a simple urine test? Your story could inspire someone else to take action before it's too late. Don't keep it to yourself. Share it in the comments below. You never know whose life you might touch today just by speaking up. And if you're serious about protecting your health after 60, you're in the right place. At Senior Sense, thousands of people just like you are learning simple ways to stay strong, independent, and informed. So hit that subscribe button and turn on the bell, because your health deserves more than just luck. It deserves knowledge. Health knowledge is power, not fear.